Hello, my friends. It is Dr. Darla Logan, and I want to talk today a little bit about vitamin K. Now, vitamin K might be a vitamin that you have heard about in terms of taking alongside of vitamin D, especially when we're dealing with issues of bone health. So bone density, osteopenia, osteoporosis. What you might not know about vitamin K is that it is also associated, low levels of vitamin K are associated with an increased risk of heart disease, an increased risk of neurodegenerative diseases, things like Parkinson's and Alzheimer's, dementia, and peripheral neuropathies, and perhaps even restless leg syndrome because of the nerve involvement with that particular diagnosis. So there are many places where vitamin K can potentially provide a lot of benefit. Many people assume that they can get an adequate amount of vitamin K from the diet, and I really, really wish that I felt like that were true. So studies actually show that the type of vitamin K that is most abundantly found in the diet, especially in your green leafy vegetables, is vitamin K1. And vitamin K1 is actually only about 10% absorbed. So if we could get the full amount of vitamin K out of the green leafies that we were eating, and we were eating an abundant amount of green leafies in our diet, which, let's be honest, most people are not really focusing on getting enough green leafy vegetables in their diet. So one, the amount that we're consuming is low, and then two, the amount that we absorb is low as well. So I don't really think that we can genuinely get enough vitamin K to actually provide treatment and longevity benefits and decrease risks of things like cardiovascular disease, diabetes, and neuropathies as we're moving forward in life. So vitamin K2 is the vitamin K that is, in my opinion, most effective, and I think that the studies support that as well. There are two different types of vitamin K. There's actually more than two, but there's really two commonly known types of vitamin K, and that is MK4 and MK7. So the one I really want to talk about today is MK7, because that is what studies support as showing the most beneficial in terms of anti-aging, longevity, a decrease in all-cause mortality, a decrease in cardiovascular disease, a decrease in diabetes, and also a beneficial improvement in your bone density, so osteopenia, osteoporosis. So we're going to stick with a discussion about vitamin K27, and that is largely found in the diet from fermented foods, natto specifically. So in the Western diet, we don't generally eat a lot of natto, although in Asian cultures, there is more natto that is included as part of the diet. So, when we're thinking about vitamin K, the thing to remember is that the liver will take whatever you take in terms of a supplement or even from the diet. The vitamin K will be used by the liver first. And so if there's any kind of liver inflammation or chronic liver disease, then the liver is going to pretty much suck all of that vitamin K up and not leave a whole lot to be used for peripheral tissue, which is why in liver disease, it might be smart to actually increase the amount of supplementation so that one, we can support what's going on in the liver, but two, we have enough left over so that our peripheral tissues like our heart and our bones and our nerves can actually benefit from vitamin K as well. So when we think about how vitamin K is used in the liver, it is used as part of the clotting factor. So it makes sure that you're able to clot appropriately if you have an injury or get a cut. And that's super important. Nobody wants to bleed to death. And that's why also some medications, it's contraindicated to take vitamin K. So if you're on any kind of blood thinning medications, be aware of that. Talk with your doctor. In terms of bones, vitamin K works with a hormone called osteocalcin, which activates the protein that tells calcium to go into the bones to form and grow and increase that bone density. So it's it's not just vitamin K, but how vitamin K utilizes another product called osteocalcin. And then also osteocalcin is super beneficial because it pulls calcium that gets stored in the walls of the arteries, or calcification of arteries. It pulls those out of the arteries and then sends it to the bone. So one of the things that I hear a lot in my office is people saying, well, I heard I shouldn't be taking vitamin D3 unless I'm also taking calcium. And I would agree with that. That is true. Vitamin D3 activates what is called, it activates the release of osteocalcin, but it's an inactive form of osteocalcin, so it's not beneficial just with vitamin D3. The osteocalcin gets released so that it could be used in terms of bone health, but what actually happens is that unless you have vitamin K, that osteocalcin doesn't become the activated form that then can be utilized in terms of bone health. So what we end up with is potentially more calcification in our arteries because we deplete the amount of osteocalcin pulling. We deplete the amount of osteocalcin and we don't replenish it with an activated amount when we are simply using vitamin D by itself. So remember that there is no magic pill or magic bullet in terms of health, is that we are a very intricate system that utilizes a lot of things. So that's why we give vitamin D3 and vitamin K2 together to keep from exhausting the amount of osteocalcin and making sure that it can be in its active form so that it can then be utilized for bone health. If we are only using vitamin D3 by itself, it's that osteocalcin that increases the risk of heart disease because of how it plays with the calcium that is stored in the arteries. So one of the biggest and most, favorited tests in order to determine cardiovascular risk right now is an artery calcium score. So being able to look and see how much calcium is being stored in your arteries is super important and kind of gives us it gives us a really accurate view of your risk of cardiovascular disease. What we know is that when we add vitamin K into the system, and usually through supplementation, we get a decrease of that calcium score. And depending on how much we're using and the quality of it that we're using, some studies will show that we can actually decrease that calcium score by around 13%. So that's how vitamin K helps to support our heart, is by decreasing the calcium store. When that calcium is then taken out of the arteries, it can then be stored to the bone. So we kind of get two bangs for our buck there. We get a decreased amount of cardiovascular disease risk, and then we also get an improvement in the bone density, especially for women who are in menopause and for men who are taking estrogen blockers. Estrogen does something very similar. We're not really going to talk about the specifics of that right now, but estrogen does something really similar in helping with bone health. So when estrogen does drop, in females, that will drop typically because of moving through perimenopause and into menopause. And then for men, that is oftentimes associated with testosterone therapy, where they are using an estrogen blocker, and the estrogen blocker then is overused, and we get a too little amount of estrogen in the male system, which can also lead to brittle bones or a low bone density mass, which increases osteoporosis and osteopenia. So we want to make sure that our our bones are nice and healthy, because as we are aging, what we want to watch out for is increased fracture risk. So there are actually quite a few studies that show that vitamin K2, along with vitamin D3, does a really good job at decreasing the amount of cardiovascular risk, increasing the amount of bone density, which secondarily decreases the amount of fracture risk. The other things that we get as a benefit is that we get a decrease in diabetes and triglycerides when we are using vitamin K2. So I'm not going to go into a whole lot of detail on that mechanism of action there, but the thing that you need to understand is that you need to be getting a good quality supplement, right? So most of this is going to be coming, like I said, from natto in terms of vitamin K2. And if you're not eating fermented natto as part of your diet, which I don't generally work with a population that is consuming a high amount of that in their diet, so most of that is coming through supplementation. If you are not using that in along with the proper vitamin D, then we don't get those bone health benefits. The other thing to remember is that vitamin K can be really, really useful in terms of energy production. So for people who are struggling with energy, if their hormones are well balanced, if their adrenal glands seem to be online, if they're eating well, but they're sleeping well, but they just still don't have good energy, vitamin K2 can be really beneficial because of the way that it works in the electronic transport chain. I don't want to get too sciencey about that, but what it does is it helps the mitochondria to produce energy. So when we are using vitamin K2, we will oftentimes have a change in our cardiac output, which increases the amount of oxygen that is floating around in the blood vessels. So we get an increased amount of oxygen, we get more blood pumping, so circulation is increased, lymph is increased, immune system is increased secondarily. But we can see definitely an improvement for people who have cardiovascular disease. We can see an improvement in their cardiac output, which is the amount of blood that's being pumped in the body in a 24-hour period. So in the anti-aging world, vitamin K is known to help with that mitochondrial dysfunction or mitochondrial, oxidation, if you will. The heart being the largest muscle in the body has a lot of mitochondria, and so that's also where we get that benefit of vitamin K. So we can increase by about 23%, depending on the dose that we're using of vitamin K, in terms of cardiac output, 13% of cardiac output and about 23% of max heart rate. So for athletes that are looking for an additional benefit in their performance and in their recovery, vitamin K may be something to utilize as well. Other things that can be helped with vitamin K are going to be dementia, joint health, cranial development, skin health, dental health, muscle function. If you're getting muscle cramps, a lot of people think about magnesium as their first go-to. Magnesium is a beautiful mineral, and I use it for a lot of different things, but it might not be the magnesium. It might be the contractibility, which is fired off by vitamin K. So that works in that muscle cascade as well. Magnesium, potassium, vitamin K are things I think about in terms of muscle function and muscle cramping, neuropathies, pins and needles, numbness in your fingers, numbness in your toes, lots of reasons for it. But don't forget to think about vitamin K as part of that picture. The mitochondrial restoration, and that's where we get that anti-aging benefit, is that we can actually help regenerate mitochondria and rescue mitochondria that is really kind of strangled or struggling, and reduce our metabolic age by adding the proper amount of vitamin K2 in. We talked about cardiac function. We talked about aging as well. So you can see that vitamin K has a far-reaching effect outside of what we oftentimes just think of it for in terms of bone health. So that's one of the things that I see a lot, is that people will know about a single vitamin for a single treatment, but they don't oftentimes realize how intertwined and how many other benefits can be brought brought to the table by utilizing that benefit. So I will wrap it up with this, is that in the Western diet, we almost get no beneficial vitamin K as part of our diet. I've kind of alluded to that a couple of times. So make sure that we're getting a good supplement, make sure that we are taking an adequate amount. So talk with your doctor about that. If you don't have a doctor that is well-versed in proper therapeutic use of nutrients and minerals, then you might consider working with a naturopathic doctor or a functional medicine doctor, because you're going to have a better likelihood of getting good recommendations on the appropriate use of those vitamins and minerals. When you go to the store and you pick things off of the shelf, 1, you might not be getting a good quality, 2, you might not be getting a therapeutic amount, and 3, you might not really be getting the proper active form. So 3 things to look for. And I'm going to be doing a different segment on those types of things, how to pick a quality supplement. So I just want to wrap it up with vitamin K2, not very plentiful in our diet, needs to be combined with vitamin D3 in terms of bone health, can be used alone in terms of other health like neuropathy and diabetes and muscle cramps, neuropathies, etc. We also want to make sure that we are getting the right amount of vitamin K in the diet to treat metabolic disorders, to prevent cardiac disease, to increase our quality of life as we're aging. So I hope that gives sheds a little bit of light on the benefits of vitamin K2 and why we use them and why we combine that with vitamin D. So if you have any questions, drop them below, and I will see if I can answer them for you. Talk to you soon. Bye-bye.